You are very welcome to this talk. Dr. Cohen, thank you so much for coming back.
It's lovely to see you.
Now, just a quick word to the viewers. I haven't got a clue what we're doing tonight. Dr. Cohen's refused to tell me. And in fact, he's even threatened to ask me some questions. So with a little bit of apprehension, but bear in mind, this is completely genuine. I will be learning with you. So we're not artificial intelligence on this channel, and we're not even prepared. Although Michael does have a lifetimes of experience to speak from. Let's go for it, Doctor.
Okay.
Start us off.
So this is going to be a little bit of a detective game for yourself and anyone who's viewing it. Before we start properly, I want you to just try something for me. It's going to be interesting to see which way this goes, and it could change the way in which the conversation develops as well afterwards.
I'm intrigued.
I want you to show if you can almost touch your forearm with your thumb. So,
oh heck! That I can do that one.
Very good answer.
Nowhere near. Nowhere near.
Okay, good. Okay, fine. Okay, because it could have changed the conversation had it gone
nowhere near.
Way.
No, miles off.
All right. Okay, so
old and stiff.
I just want to, just for the record, neither can I. Okay.
Right.
Now, if I tried, I would have to break my wrist over here.
Me too.
Okay?
I think. Yeah, me
so
too.
I want everyone to hold that image, okay? Because I want to tell you about 4 different patients, okay?
Yeah.
4 completely different people, different ages, different problems, different hospitals, different specialists, and they all have something running through them that took me probably quite an embarrassingly long time to see. So I want to get into that with you. Sometimes it took actually years to come up with what was wrong. So each time one of them came in, the problem that they presented with made complete sense on its own. And it was only when I started looking at the whole story over a long period of time that something started to itch. And there was a pattern, and once you see that pattern, you can't unsee it. And I want to see if it can be spotted by yourself, by people who are watching this, before I say actually what it is. So I'll start. First patient, a young woman in her late 20s. She's fit, lean, sporty, genuinely athletic. She's got no medical history of note. She comes in with lower back pain. And eventually it progresses and she has an MRI, and in the MRI it shows that she's got a prolapsed disc. So the cushion between the vertebrae low down in the back is basically pushed through, is ruptured, pressing on a nerve. Now, eventually she ends up going through physiotherapy, and that doesn't really work, and it goes over a period of time, and much later she ends up having surgery to the back. And the surgery goes well, and she's better, and I consider the problem dealt with. About a year later, she comes back, but this time it's not a pain in the back, but she's got a hernia, an inguinal hernia, which is a hernia in the groin. Now, you probably know that the inguinal hernias in women are actually quite unusual. They usually happen in men. A lifetime risk in a man is about 25%. And so for a woman, it's in the region of 1 to 2%. So if someone is young, slim, active, never been pregnant, and they have one of these hernias, it's actually somewhat interesting. She eventually has surgery, and the surgery goes well. And then a while later, she comes back and she's developing varicose veins. Okay, now varicose veins are basically tortuous veins usually at the back of the legs, but also at the front of the legs, and they become more and more significant over time. And over time, later on, she ends up having surgery again. And then at that point, I started sitting back and thinking, what's going on with this person? You know, she's young, fit, slim, healthy, athletic. Later on, so this is a period of years, she develops what's called metabolic syndrome. So she's basically becoming pre-diabetic. Her sugar levels rising. And again, she's got a great, she's thin, she's active, she eats healthily. There's no obvious reason for this, but her sugar levels are beginning to go out of control. So, and again, young. So this was a bit this was something that made me stand back and think. And each specialist that she saw did their job correctly, textbook outcomes, and yet she kept coming back with different problems from different directions. And at that point, something shifted in my thinking, and I was thinking, this isn't just bad luck. Something seems to be going on under all of this, but I didn't quite know what at the time. So I just want you to keep that in mind, and we'll go on to the next patient. And the next patient is another woman who's actually had 3 children. She's now about 38 years old. She's not a patient of mine. I hadn't seen her before. I actually saw her fairly recently and put this together. She's been through a marathon of pregnancies, childbirths. She's also had varicose veins, significant ones, but somewhat more striking. She actually had brown staining in her lower legs and feet because it's a condition called hemosiderosis, which is when the incompetence of the valves results in pressure, and the back pressure causes iron to leak out into the tissues, and it permanently stains the skin, basically. So it's quite significant. The other thing that she had was that she had a disc prolapse as well, so a protrusion of a disc, but it was in her neck, not in her lower back. Okay, so this wasn't a common thing. And then another thing that she also had over time was carpal tunnel syndrome, which is when you get pressure on the median nerve, which runs through let's call it a channel in the wrist. And she had it on both sides at the same time, and that causes tingling, and it can cause weakness in the hands. All of these things have potential fixes. So you can potentially fix the cervical disc, you can fix the carpal tunnel syndrome. Of each thing in itself, they're fairly common things, except maybe the neck thing. And you might think about her occupation, posture, repetitive movement, many things that can cause it. But again, she had it in both hands at the same time. And then another thing happened to her, which was that she had something that looked like and was labeled as Meniere's disease. And Meniere's disease is when a person gets vertigo, they can get a degree of hearing loss. So they get spinning sensations, some hearing loss. And they get tinnitus, which is ringing sounds or various sounds in the ear, and it's caused by a problem in the inner ear. So this was her story, so she basically had about 5 different medical problems, 5 diagnoses technically. But when I was looking at this whole story, I was seeing actually just one problem wearing 5 different costumes, if you like. And again, she'd spent years in the medical system, going from one specialist to another, each time having something, diagnosed or treated, and then coming back. And that also takes a toll on somebody, obviously.
Oh, yeah.
Now, number 3. Another young, thin woman, no family history, no obvious risk factors. She develops high blood pressure without a clear cause. She's had what's called preeclampsia near the end of her pregnancy, so it's when the blood pressure goes very high, and which can actually be a risk to both the mother and the baby's lives, potentially. And the interesting thing about her blood pressure is that it's labile. It sort of like goes up and down, and at rest it can seem almost normal, and under standing conditions or under stress it can spike, it can go up. It's easy, basically it's quite easy to miss that. So she's had this problem, and in preeclampsia there's a connection. In a normal pregnancy, the placenta of the fetus physically remodels the arteries that supply it. So it converts the normally high resistance arteries into wider and low resistance channels, and that remodeling of those blood vessels requires some restructuring, and in preeclampsia normally what happens is that process is incomplete, and so the placenta doesn't get the blood flow it needs, and that sort of shallow and incomplete arterial conversion is the initiating event in preeclampsia. And I hope that's not too technical, and I'm going to stop boring everyone. I'm going to get on to case number 4. Now, case number 4 is a 38-year-old man. He gets an MRI because I saw him for migraines, which were fairly new onset with him, and he had certain features, and I sent him for an MRI.
Yep.
And the thing that came up on his MRI was an aneurysm in his brain. Now, an aneurysm, this was an incidental finding because the aneurysm was not the cause of his migraines, okay? It just happened to be found because we were checking for other things. And that incidental finding almost certainly saved his life because he had basically an aneurysm is a bulge in an arterial wall where the vessel has become weak and it's stretched. And if that happens in the brain, it can rupture and you can have what's called a hemorrhagic stroke. So a stroke that's a result of bleeding into the brain.
And at that age, you'd suspect a congenital abnormality at that age, presumably.
Exactly. And it's got a very high mortality, severe disability in people who survive it. Yeah. But more things with him, it also turned out that he had a new onset of high blood pressure. And if you want to guess, varicose veins and later on a hernia. Okay, now these are all things that developed over time. So he's got this weakened artery wall in the brain, he's got fragile blood vessels in the legs, and here now we're talking about 4 patients, okay? And these are people I've seen over years. So before I tell you what connects them, I'm interested to know what your instinct is. What do you think is the thread that's going through all of this?
I think we're looking at some sort of connective tissue disorder.
Spot on.
And what comes to mind? So we've got the lower back pain, the prolapse. Again, it's the integrity of the tissues. The varicose veins. Again, the tissues in the wall. Let me come back to the metabolic syndrome. The varicose veins, the disc in the neck, the carpal tunnel. Again, you've got a lot of tissues around there. I guess. So something could go wrong there. Not too sure about the menias and the vertigo. Not too sure about that. The preeclampsia, clearly, again, you're dealing with the tissues in the wall of the blood vessels. Migraines, again, a vascular component to that. Aneurysm, certainly a vascular component. The blood pressure going up in 2 of these patients. Just wondering there about the blood supply to the kidneys, maybe. The kidneys are chucking out more of this renin stuff that controls blood pressure. The metabolic syndrome.
I think we should switch places. You should be doing this.
This is totally guessing, Michael. The metabolic syndrome. I mean, normally if the blood sugar's up, you're either thinking about reduction of in the output of insulin, or more probably, you're thinking about insulin resistance and inability to use insulin in the tissues. But given that this patient's relatively young, you wouldn't expect her to have time to develop insulin resistance, but that metabolic syndrome doesn't quite add up there.
Young and thin.
So the metabolic syndrome doesn't quite add up. Was she hypertensive and hypercholesterolemic?
Not hypertensive, not hypercholesterolemic as far as I can remember.
Right, in that case, I'm going to go for a more type 1 type diabetes scenario, I think, where the beta cells aren't quite right.
Let's put that aside. But you're spot on. It is a connective tissue problem, and it's not fibromyalgia. It's not an autoimmune disease or anything like that. It's not inflammatory. It's something structural, and it's something that all of these people were born with. And so the answer is
Ehlers-Danlos?
Collagen. Yes, Ehlers-Danlos syndrome.
Okay. Collagen,
So collagen being the thing which most people think that collagen is something that
you fill your lips with.
Something to do with skin creams and stuff like that. It's been hijacked by the beauty industry. But it's the structural protein that connective tissue is made of. And connective tissue is basically the scaffolding that the entire body is built on. And it holds your joints together, it gives your vertebral discs their strength, it keeps your vein walls from overstretching, prevents hernias from happening, it's in the walls of the arteries, it's in the gut, it's everywhere. And if that scaffolding is even subtly faulty, too loose, not quite strong enough, then everything built on it starts to show the strain. And that doesn't happen all at once. It happens one thing at a time, years apart. And that's why these people present in this way. So basically it's a group of inherited connective tissue disorders. You're born with it. There are 13 different recognized subtypes.
Really?
And actually the most common one is hypermobile, which accounts for around 90% of the cases, and it's almost certainly the most underdiagnosed one, I should say, of all of them. And it's also the one that doesn't have they haven't found like a distinct genetic type for it. So it's very much a clinical diagnosis. You find it by examining the patient and by listening to the story. Now, when I was in medical school, eons ago, the old textbooks put it around 1 in 5,000 people, and we thought it was incredibly rare, and you might see one person, 2 people in your life or whatever. And I see quite a lot, and I regularly see people with similar things, but just to varying degrees. So I think that was almost certainly a dramatic underestimate. The best figure, the most recent sort of figures are it's around 1 in 500 people, and some places they find that it's even more than that. So it's actually, it's not a rare disease. It's actually quite a common disease that medicine hasn't fully woken up to yet, we'll say. Right.
Underdiagnosed.
Yeah, and I think that it's very prevalent. I mean, the people know people who've got hypermobility, and it's just, people just don't really recognize it. It's just kind of like, oh yeah, you can do this with your thumb to your forearm, and I can bend my fingers back and stuff like this. But it has quite a lot of health implications. It has quite a lot of health implications. And by the way, there's a test that can be done. It's called the Beighton score. It takes about 2 minutes, literally 2 minutes. And you can do it by the bedside without any equipment. It's basically a number of scores. It goes from 0 to 9. And it involves checking thumb flexibility, forward flexion at the hips with your knees straight, and if you can touch your hands flat on the floor. It's to do whether your knees extend too much, and there's one other thing it's not coming to my head right now. There's a couple of other things that are not coming to my head right now. So that's what it is. Now, what does it actually do to the body? I think that people are going to start recognizing this. First of all, as I said before, the joints are too flexible. They can be painful, prone to injury. So people who do Pilates or yoga or whatever, they might tend to injure themselves more because they don't realize that they're actually not meant to be overstretching. They've already got joints that can overstretch, and they may go further than that, right?
To show off.
Well, no, just for themselves. They think that they're just doing it to the best of their abilities, in whether to show off or not, I don't know. But they can also suffer partial dislocations or full dislocations, the shoulder, the patella, the kneecap. The scans that are done will come back normal, so they're told there's nothing really wrong. They can have early spinal disc disease, like these patients who had a cervical disc prolapse or lumbar disc prolapse, and they often have widespread chronic pain that doesn't respond to painkillers because the cause is a structural cause. It's not an inflammatory cause. It's not like there's some major inflammation going on. This is just purely the stretch of the ligaments. And an instability, let's say, in certain joints. And if those are joints that you're walking on a lot or using a lot, then you're going to be more prone to pain. We spoke about the veins. They can have varicose veins. They can also get pains inside their pelvis because you can get what's called a pelvic congestion syndrome. So you've actually got a kind of varicose veins, so veins that are open and dilated and weak, and they basically they engorge with blood when you stand up, and so people can get this inside their pelvis, and it can often go unrecognized or some kind of like vague symptoms. They can also have aneurysms, like the chap who had this one in the brain. Nerve compressions, all of the things that were described.
Remarkably painful nerve compression.
Yes.
Extreme agonizing condition.
There's also another condition that goes with this very often, which is called POTS, or postural orthostatic tachycardia syndrome. And it's very often associated with it. And so when you stand up, your blood vessels are supposed to tighten and push back push blood back up against gravity. And in POTS, that doesn't happen adequately. So blood pools in the lower body, and then your heart rate shoots up. It can shoot up by 30 beats a minute or more within 10 minutes of standing, to try and compensate for the fact that that the blood vessels are not squeezing, as it were.
Yeah, you're losing the vascular tone that's keeping
exactly. And then as a result of that, a person can feel dizzy, exhausted, foggy. They can feel that their heart is pounding, they get palpitations, and they're often told for years that they're just anxious or that they're unfit. And the cruel irony is that POTS creates a physical state that's indistinguishable from anxiety, right? They still get they get a high heart rate, they have a feeling of like an adrenaline rush, the same kinds of sensations. And so the label fits on a superficial level. But if you treat the anxiety without treating the underlying problem, which is the autonomic problem that results from this, it's kind of like treating the smoke and ignoring the fire. It also affects the gut, so people can have their peristalsis, it can be loose, so you can actually get things like gastroparesis when the stomach doesn't empty and people get bloated. They can have erratic bowel habits, and something like 60% of people with Ehlers-Danlos syndrome have at least one significant gut symptom.
Really? Right.
And on a mental level, people, we mentioned before anxiety, but there's anxiety, depression, the rates are strikingly high. Some studies report over 80%. And part of that is obvious. It's because of chronic pain being dismissed, years of accumulating diagnoses with no unifying answer. But the biology also goes deeper than that, because basically the brain is fundamentally a prediction machine, okay? It builds a model of what's happening in the body at any moment in time, and it makes predictions and checks them against the incoming signals all the time. So in a healthy body, the predictions usually match, okay? So if I move my arm here, I can feel a pain here and it stops. In EDS, the body signals are not reliable because the joints that should be stable are not. And blood pressure fluctuates unexpectedly, and the internal body sense is noisy and it's inaccurate. And the brain, what the brain does is to try and make its best prediction, but it keeps getting it wrong. And so the nervous system is constantly getting persistent, unresolvable error signals, let's say. And
so there's lack of proprioception, isn't it? And that I never thought of that.
And so the anxiety is basically it's a natural result of this. It's not a psychological weakness. Or a character flaw. It's actually a complete result of the physiology of what's going on, because it's trying to manage an unpredictable body.
Well, anxiety can be a disease in its own right, I believe. Generalized anxiety disorder. It's common. But no, that makes sense. That you've actually got a biological basis for the anxiety. Well, maybe you always have, but here you've got an obvious biological basis for the anxiety. Can you give me a clue about the metabolic syndrome and the?
So I did look into this, and it has got something to do with. I'm just trying to remember it myself. You're testing me now.
Absolutely.
It has got something to do with, first of all, the high blood pressure has got to do with the renovascular system. So So abnormal blood vessels in the kidneys can result in this happening.
The kidneys are controlling blood pressure on a day-by-day basis, aren't they?
And in addition to that, when you've got dilated arteries, you have an unreliable system, and so blood pressure is more likely to become labile, so it's not able to respond in the same way as usual. I'm trying to think about, the other thing was actually about metabolic syndrome, which is what you asked about. And I'm trying to remember why. Metabolic syndrome.
I'm just trying to think of something. Is it affecting the pancreas directly?
I think it probably, if I remember right, yes, I think it is affecting vessels in the pancreas. And,
so it could be related to pancreatic ducts or something like that. That's conceivable.
And the pancreas is obviously where the beta cells are, which control insulin secretion, etc.
Yeah.
So yes, it's probably something like that. I'm not so sure how. I think everything that I read about it didn't really come up with a definitive answer.
It might not be fully
known.
But like repeated episodes of pancreatitis, for example, because of the disruption to the pancreatic tissue, are going to result in loss of the beta cells, the insulin-producing cells, over time. And there was a disorder of the vasculature that kind of makes sense as well, or indeed disorders of the pancreatic ducts. Yeah. If you weren't getting proper drainage of the pancreatic enzymes, you could be getting sort of micropancreatitis, as it were,
absolutely.
Where the pancreas is digesting itself.
Very much a supposition that it's to do, like you said, with the vasculature in the pancreas.
Yeah. But without definitive pathology, you can make up any explanation you want, of course.
For sure, yeah. I'm not sure how
there are interesting hypotheses.
Yeah. So I've actually... I made a video that's more detailed about this, and it will be uploaded on my channel at some point soon as well. So it will go into more detail to answer those questions.
Yep. No, that is that's it's really good that it gets you thinking. A lot of people.
I thought it was very interesting because I think there are so many people who have this. I see it so commonly in my job. And I think that many people don't recognize themselves as having any of these things, and they probably think they're going a bit mad. Like, I've got this, and I've got this, and I've got this, and I've got chronic pains, and no one can actually see anything very wrong.
They're always complaining about something.
Yeah,
there's always something wrong with them. Indeed. I guess this is kind of I would call this abductive reasoning, where you take various observations. And they might, the kind of, you think what is most likely based on these various observations, and you make inference to the best explanation.
Yeah.
Is there a definitive diagnosis? Do the histologists, do you take a biopsy or something?
They do genetic studies. The genetics come up with it, except for, as I said, in the most common one, which is hypermobile EDS, which there is no, currently that I'm aware of, there's no single genetic signature for it. But it becomes very obvious from the history and from the examination. So I think this is very much more about an awareness problem. I think that also the more that medicine becomes compartmentalized, people tend to, you go to this specialist for this specialist for that, and people don't put two and two together. And you send someone with a disc herniation to a back surgeon, and if they end up having surgery, they think that's the end of it. And then if they come back 2 years later and needs another surgery, it's like, well, that's just bad luck,
or then they see a completely different surgeon
or whatever, any number of reasons. And if they go to different GPs because they move address or something, and no one's putting two and two together because it's not the same person who's actually following them up. And I think that one of the things about I would hope in time now more and more so is that we as doctors will become more and more aware of how this is actually quite a common condition in its various forms and to varying degrees. And that we need to be that little bit more pedantic about checking for this hypermobility. You also need to listen, by the way, you need to listen to people's hearts because they can have a murmur, which rarely results in a serious problem, but they can have things like mitral valve prolapse, which can give them symptoms of palpitations and things like this, or some slight breathlessness. So there's a whole bunch of things here that needs to be looked out for.
Makes perfect sense. The heart valves are very high in connective tissues and collagen and pretty tough things. I mean, when you consider these things are flapping around in some people for 90 years, and they must be pretty tough. It really is quite astonishing how amazing these biological materials are. Very important point about compartmentalization. I've worked with doctors who said, for example, a doctor might be an endocrine specialist, and you say, well, what about the something else? What about the neurological condition? He says, I don't know about that, but the diabetes is well controlled. I'm off for a cup of tea now. They just look at their own feel. I mean, even when I was young, I mean, we used to have physicians. Now we have neurophysicians. Well, we always did, but we, in a district general hospital, we have renal physicians, we have endocrinological physicians. When I was young, we had in the hospital there's about 4 physicians.
General physician. General physician.
Yeah. Same with surgeons. We had 4 general surgeons who could do just about anything. It was quite incredible, and that is a real problem. This compartmentalisation, lack of holism, really, isn't it?
Yeah, I mean, I think it's somewhat inevitable, sadly, that the more medicine advances into doing super specialised stuff, it's very hard for anyone to become good at a particular specialty and still maintain general specialization, if you want to call it that. One of the few examples that you see of a general surgeon who really does do everything, at least until a few years ago, was pediatric surgeons, so children's surgeons, because you're dealing with such small children. Other than those who are dealing with the heart and lungs, they would pretty much deal with all the different types of surgeries involving a child, pretty much. I mean, I'm sure that even now it's becoming super specialized.
It is, yeah. Terrifying, operating on children. I've seen it a few times, but interesting, collagen. So people don't realise, people do realise, but vitamin C is essential for collagen formation. You can't make it, and there's a disease called scurvy, where the vitamin C is no longer available, and the collagen throughout the body degenerates.
Correct.
So you might get old wounds that have been healed up for 50 years that all of a sudden fall apart, and bleeding from the gums. And
if my history of medicine is correct, I think that's why the Brits were called limeys.
Indeed it is, yes.
Because they took limes on board the ships when they realised that's what would cure them or prevent the development of scurvy. Vitamin C is actually useful when people have injuries. It's always worth taking extra vitamin C until the injury heals, because it actually improves the healing process.
I agree. Why would you want to be a little bit short of vitamin C and delay all the healing process?
Absolutely. Absolutely.
Yeah. I mean, I always tell people with any injury to take 1 gram a day without hesitation. I mean, as long as there's no contraindication to that. But we perhaps tend to underdose vitamin C with current thinking, because the guidelines, you might read the guidelines that say the recommended daily minimums 50 milligrams a day, but these minimums are actually calculated as enough to abate the symptoms of scurvy. Whereas we actually want to optimize our physiology, not just prevent deficiency disease, as we're only too well aware. Well, the interesting thing about collagen is if you take a mouse liver, for example, and you mush it up, you'll find there's not much collagen in it as a percentage of overall hepatic tissue. But if you take a larger animal like us, there'll be much more collagen in it, because more mass has to be held in place. And if you take together. If you take elephants, I don't know about whales because they're supported by the water, but the larger the animal, the greater the percentage of collagen.
Yeah, it makes sense.
So the design of every tissue in every animal is fine-tuned to have just the right amount of collagen. It's just another layer of amazing complexity to this bizarre emergent phenomena that we call life. It's absolutely quite incredible. Fantastic, Michael. Actually, really quite interesting putting that all together. And without you taking an overview on that, these patients could have gone on one condition at a time, thinking they were defective in some way. And
I do think that it's important that people get a diagnosis. Number one, so that they sort of know what they're dealing with. They can try and avoid injuries, for example. I often tell people, doing sports or whatever, so just be careful not to overdo it. Don't overstretch. You're more likely to have a dislocation. You're more likely to injure your joints. So you've got to look after yourself a bit better. You may need to do more muscle strengthening exercises in a more careful environment, in a more careful way. And also so that they know that they're not going mad, right? And people who are suffering with chronic pain and no obvious cause for it, they haven't got some obvious inflammation or something like that, it can be very frustrating, and everyone's telling you, no, there's nothing wrong with you, nothing wrong with you. Okay, there's nothing wrong with you. Okay, but so what is wrong?
Absolutely. And then very often patients get a tremendous relief when they get a diagnosis.
Just from the knowledge,
Yeah, I mean, we talk about not labelling patients, which is correct, but a lot of people really appreciate it. Oh, is that what it is? And it really is necessary all round.
It can also have very serious implications, and particularly with pregnancy, by the way, where there's a particularly severe form of EDS called vascular EDS. So it's more than what we were just talking about.
Yeah.
But it's when I mentioned about preeclampsia. Anyone who's got vascular EDS, which is more severe, and it really does affect the arteries. When they become pregnant, they really need to be under highly specialized care and very regular follow-up by specialists in the hospital, because they're at a much higher risk of things going wrong with that pregnancy.
That's literally the difference between life and death for the mother and the unborn child, potentially.
Yeah.
Great stuff, Michael. Thank you. I really enjoyed that, actually, because I genuinely didn't know what was happening there. So
neither did I.
Yeah. No, it's sometimes I feel a bit guilty about being interested in these things, because basically we're studying human pain, suffering, and death, which is appalling, and we want to eradicate it. But at the same time, it is remarkably interesting and intellectually stimulating to try and work out what's going on.
Yeah, but I think you have to have that, otherwise you don't get to the answers that you need to get to in order to help people.
Yeah. I mean, I think the fact that you were thinking about that, I always said to my students, being a good nurse is not something you learn; it's something you are. And that's the fact that you're thinking in those terms means that you don't just go to work and be a doctor for 8 hours a day. It's something you are. It starts coming from inside, doesn't it?
Yeah, I think it's something also that can develop. Honestly, I really think it's something that can develop.
I agree. Yeah, absolutely. Michael, as always, thank you so much, and we look forward to the next time. So thank you so much.
I look forward to it too. Take care.
You too. Thank you.
Bye-bye.
Bye. Bye-bye.